As of 2020, the prevalence of dementia in Korea is 10.2% of the population aged over 65. This accounts for 840,000 patients, 1 in 10 elderly people. Additionally, dementia holds the record for the longest hospitalization among neurodegenerative diseases. Last year in Korea, the total number of hospitalization days for all dementia patients was 22,057,707 days. The total medical cost was $1,472,273,900, ranking first in total medical expenses. Urgent countermeasures are needed in order to combat the ever-increasing number of dementia patients. Due to the unknown origin of the disease, drugs that were approved by the FDA only show limited effects. Safety concern is another element that has held back the development of effective treatment. No fundamental cure has been developed yet to this date. In addition, the high-dose radiation therapy device currently used for cancer treatment is being used for clinical research on dementia, but it has a limitation in that the operating cost is high and the radiation dose rate per unit time is high to be used for the purpose of treating inflammatory diseases such as dementia, so the treatment efficiency is lowered. The need for a new Alzheimer's dementia treatment is urgent. In response, Reticure Corporation has developed the world's first dementia-only radiation treatment system, AMG 300. This equipment is a new concept radiation system capable of self-shielding with X-ray generation using carbon nanotubes. It is versatile due to its ability to control radiation energy at low dose rates. The radiation beam emission method is a pulse-type system optimized for dementia treatment. What is low-dose radiation used by AMG 300, also known as AMG 3 series? It means a low dose of radiation compared to the traditional radiation therapy used for cancer patients, reducing side effects while maximizing nerve regeneration. In one treatment, a low dose of 50 centigrade, a low dose rate of 50 centigrade per minute, and pulsed X-rays are used. In the brain of elderly patients, factors such as genetics and aging result in the decrease in the ability to process amyloid beta and tau. Accumulation of the two result in chronic inflammation. Overactivity of microglia and astrocytes result in the damage of the patient's nerve cells. This results in reduce in brain volume and eventually decrease in memory due to cognitive decline. When low-dose radiation therapy is administered to these Alzheimer's patients, the anti-inflammatory and neuroprotective effects transform the overactive microglia to normal activity. Reducing the abnormal proteins, amyloid beta and tau, that acts as scavengers in the brain are reduced in order to restore a healthy brain. These mechanisms help patients recover their memory and cognitive function to a normal level for a healthy quality of life. More efficient treatments based on AI are enabled through low-dose radiation treatment, AMG 300. Reticure Corporation's radiation therapy equipment is an artificial intelligence-based system that automatically adjusts X-ray energy, radiation angle, radiation dose, and dose rate according to the treatment purpose and individual characteristics to optimize radiation therapy. Reticure Corporation provides real-time patient data to physicians, providing an efficient working environment. The optimized working environment is realized through the subscription sharing service provided by Ledycuor Corporation. The introduction of radiation therapy system in our hospitals increases the burden of equipment acquisition costs and the need for hiring radiation oncologists, medical physicists, and specialized radiation therapies. Ledycuor Corporation not only manufactures AMG3 series equipment, but also develops and provides manufacturer and specialized artificial intelligence-based software. Through this software, a remote real-time connection to the hospital equipment system, where the AMG3 series is installed, can be directly performed without the need for additional personnel or facility investment in the hospital. Hospitals can receive AI software based on AMG3 series and Internet of Things through subscription before equipment purchase. The self-shielding feature of the equipment allows the user to cut cost of radiation reduction equipment. The factor that the customer has to account is the appropriate space for the equipment to be installed. Our specialist team is able to remotely communicate with oncologists, medical physicists, and professional radiation therapists before and after purchase. This reduces travel and maintenance cost. Dementia stands as a disease with no fundamental cure due to its unknown cause. A revolutionary concept with low cost and high efficiency for dementia guaranteed. Place your trust in Ledycuor Corporation.